I remember one of my daughters, she said to me, I'm going to grow up and become a doctor so that I can help make you better. That was devastating for me. And I have self-harmed because I was hoping that for just 1 minute, I could think of something else. I feel ashamed to fight thoughts of self-harm that could even be worse.
We see a broken leg, we see blood results, but we don't see mental illness. The society now is a go, go, go society. We live our own separate lives. We don't have our grandmas and our mothers living in the same house with us, right? So what about all the stuff that's piling up? We're not a village anymore. I think we used to be a village, and I don't think we're a village anymore. That's hard.
This is a very busy hospital. We work very hard. Like, we talk about it constantly, about how we have to overcome the geography of our space. This is a case where we're confined. There's no capacity here to have some fresh air come in because we don't have the space to do it.
When I come here, it's because I need some calmness. I need to refocus, regroup. It's hard to do that when you have so many people around all the time. All the time. It's become so overcrowded now that one has to wonder whether it's therapeutic or not.
Of all the things that I would want to fix, this is the one that keeps me up at night. And I know from my experience, as a nurse, that a mental health environment needs to have calm and peace. And I knew that this was a real struggle for folks here.
Mental illness is like an epidemic right now. We don't get a lot of people that listen to us. It's still a stigma. This is the safest place for me. And I see people like me. It seems like it's welcoming, that when I'm not here and I'm where I am at home, it's like I'm by myself.
We have so much to offer with the great team that we have, with the groups that we have here, even the pet therapy, the music therapy. And when they are not admitted up to the unit because we don't have beds, they don't take advantage of that.
Everybody should have a protest song, and this is my only one. You get the blankets and I'll take a tent and we'll get away from the government. They like to think they run everything now. My eldest son had what I refer to as the 10 lost years, when he was in and out of rooms like this all the time. He's a musician, and so I would take the guitar down and we'd play. It clicks in with our being that is not the nuts and bolts of life. I mean, you get people who say, oh, you just made my day.
Just to get me back is like the most important thing. Like, back when I was home, I felt like my brain was in the abyss. Like, I just didn't know who I was. I'm just living like a zombie, make my daughter's lunch, feed her and everything, and just feel like a piece of furniture basically in my home. But I just want to get my life back and actually have a purpose again.
We just owe it to them. They are so vulnerable. We owe it to them to give them the very best we can give them. We have a proposal that we've been working through with government for an expansion of 12 beds in our inpatient mental health program area. We really need to get started on that as soon as possible.
Nothing concrete has been happening. We are saying that we are applying for beds and beds will come, but we don't have a clear answer.
We strive for the best, but I don't think we're at the best. I feel for the patients, I feel for the families. It's not acceptable. We're here to provide best care, and sometimes we're not there.